Welcome to LECOM Health Matters. Our guest today is Dr. Seth Carter, a geriatric and family physician at LECOM. Seth, welcome.
Thank you.
And thank you for being with us. You deal a lot with osteoporosis, I suspect, in your practice. And most people, I think, don't really understand what it is. So on a basic level, what is osteoporosis?
So osteoporosis, I think a simple way to think about it is it's a thinning of the bones, that the structure of your bone just isn't what it's supposed to be. And so it's more brittle and it's easier to fracture. And so it increases a person's risk to if they have a fall or some sort of an impact that you can break those bones because they're so brittle and thin.
Bones all over the body or in particular places of the body?
All over, but we tend to see the worst situations are in the spine, in the hips, and in the arms, or not just hips, but like in your legs and in your arms. So those are the things that usually when those fracture, they cause the most pain and discomfort and dysfunction, and can be debilitating under the right circumstances. And so they can set back a person's well-being and health.
Is there a particular population that osteoporosis is more prone to be found, or is it generic across the board?
Yeah, so it usually occurs more often in postmenopausal women, but we do see it in older men. And so that's usually where those are the demographics that we tend to screen. So we'll screen women, postmenopausal women, usually starting at 65. And then men usually catch up, and at 75, we start screening them.
When you say you screen them, how is that done?
So right now, standard of care is that we do a DEXA scan or a bone mineral density evaluation, where they take a look at different bones in the body, and it's kind of like a specific type of imaging that will highlight whether or not the bones are thinning and becoming a little more brittle. And so that bone mineral density will give you a score. We call it a T-score, and that helps us to determine their likelihood of fracturing. And so again, like we start screening them at 65 and men at 75.
So the process would be if someone comes to you and you suspect, you would refer them to this DEXA scan procedure. Is that a painful procedure, the DEXA scan?
No, it's not painful at all. It's just as simple as an X-ray, and it doesn't take very long either. And so simple procedure, hardly an inconvenience to the patient or the person.
If someone is at home listening to this, and we hope that they do, and they're worried about themselves or mom and dad, what might some factors be that they could observe that they could come to the conclusion, I think I have a problem here, I have to call Dr. Carter?
Yeah, so for osteoporosis, it's kind of a silent issue. There's not really any symptoms. Sometimes I'll have patients say, I've got achy bones. I think I've got osteoporosis.
Oh, God, I'm a candidate.
And yeah, and that's I think that's a misconception. You don't necessarily feel that thinning or that weakening of your bones. And so really what it is we just have to screen for it. Now, if you have certain risk factors for it, then you have a higher likelihood of having problems. Some of those risk factors include smoking, having a poor diet that doesn't have adequate amount of calcium or vitamin D in it. Excessive alcohol intake can also thin your bones. And then also another risk factor is if the person is prone to falling or very unsteady on their feet, that can be a concern, especially in our older females. And again, males kind of catch up around 75. So we have to make sure that we are eliminating fall risks in the home and in the patient's environment.
What's the percentage of male and females that would have this?
Population. I don't know I haven't looked at the epidemiology recently, but it does heavily favor women until later in in years. So
Right.
again, we start screening women younger because there's something about that postmenopausal phase where the lower estrogen levels that lend them to having an increased risk of developing osteoporosis.
If I'm a younger person and I want to avoid it, is there a way that I can avoid it, or is it simply going to happen if it happens?
Yeah. So again, going back to those risk factors I mentioned earlier, whenever I have a patient ask me how, I had a mom that had this, or I had a grandmother that had this, how do I prevent it? We talk about, smoking cessation. If they're smoking, getting them to stop and give up the cigarettes.
Smoking can actually affect your bone density.
Yes, smoking affects a lot of the organs in the body,
Why
including
is
your
that?
bones. It's just a bad toxin for your body. It encourages a high inflammatory state in your body, and anytime you have high inflammation, it causes all sorts of problems. It encourages development of cancers and organ failure, including the bones start to fail. They
Because the
start to
bone
thin
isn't
out.
working, is it not? It's not
Yeah.
just a
Yeah, it's the
bone.
skeletal. Yeah, it's a skeletal system. It's alive. It's always repairing and replacing and turning over those that bone, and that structure is always being renewed and reinforced in a healthy individual.
I don't think people realize that their bones, in fact, are. I think they see them as like a piece of structural steel, so to speak, in their body that
Uh-huh.
isn't really alive or isn't really functioning. But it is.
But it is, yes, and that's partly how we treat it. Is we look at those cells that are involved in the growth and the breakdown of the bones, and we try to control that process so that it lends to better bone health. So there are two different types of. Well, there are a lot of different cells involved, but the two main ones are there are certain cells that help build up bone and grow the bone, and then there are certain cells that break down the bones. And again, that's important because as you age and as you grow, your weight changes, your gait pattern changes, how you walk and all that sort of changes. And so your bones are always trying to regrow and strengthen certain areas where they get a lot of stress or a lot of weight that they have to deal with. So those little cells kind of go in there and they help in that process. And if a patient, again, if they develop osteoporosis or if they have some bone disease, what we are looking to do with a lot of the medications that we use when we need to use medication is we kind of control more. We try to encourage the cells that grow bone to grow more and the cells that break down bone to break down less bone so that it can reinforce that bone.
I think it's just amazing when you start talking about bones as living organisms that people, I don't think they really appreciate or understand that they are. They're
Right.
alive.
Right.
They're
Yeah.
not dead, so
They're-
to speak.
Right. It's not like your hair, right? Your hair, it's alive when it comes out, but as it exits, then it's not really a live thing.
And
So-
for some of us, it has exited long ago and
Right.
far away. So let's assume, Chad, let's assume somebody's they've gone to you, they've gone to the DEXA scan, their T-score demonstrates that they have osteoporosis.
Mhm.
Would it be all over their body or only in particular bones in their body? Or is that something the DEXA scan would tell you?
Again, it will tell us which bones have more problems. The DEXA scan will, but again, the treatment is the same. Rarely are we going to focus in like, oh, we just got to focus in on the hip bone. We're going to be treating the whole body. Yeah, like any good physician should do. They should treat the whole body and the whole patient rather than just focusing in on one place.
And that treatment, after my diagnosis and after my T-score and after I see you, what is that? Is it IV? Is it pills? Is it medication? Is it shots? I'm sure there are varied treatments.
Yeah, there are varied treatments, and it depends on what your score is. So the first thing is I always talk about lifestyle changes. So again, reducing smoking, reducing alcohol intake, increasing calcium and vitamin D intake into their diet. The goal should be for example, a postmenopausal woman, she should have around 1,200 milligrams of calcium in her diet a day, as well as 800 international units of vitamin D. So whether they're getting that from their diet or their diet and supplementation, if they're taking like a multivitamin or something, using, between the two of those, it needs to add up to over 1,200 milligrams of calcium and the 800 international units of vitamin D. So I always start to encourage, and we talk about eating high calcium foods, making sure that they're getting plenty of green leafy vegetables, fresh fruits and vegetables. I'm a big advocate of the Mediterranean diet.
I know you are.
If I can fit that in whatever I'm talking about, the Mediterranean diet is an anti-osteoporosis diet. So again, it's low inflammatory, high in all the fresh fruits and minerals and the whole grains that will help your body have what it needs. But on occasion, you'll still need to, with that dietary change, supplement with calcium and vitamin D supplements. Again, other things that you can do is resistance exercises. So actually that weight bearing type of an exercise where you're either lifting weights, or if you have those exercise bands or resistance type things, the Bowflex and those types of exercise equipments that creates resistance, and that helps. That resistance, that force on the bones, kind of wakes up the bone regrowth and reinforcement of the bones so that they grow stronger and more resistant.
So
to fracture.
Once diagnosed does not mean sit in your chair.
No, it means get up and get moving
Get up
again.
and get moving
Yeah.
again and do what you can do within reason.
Exactly. Yeah.
Are there particular medications you might use?
So as far as medications go, you can have there are pills. Typically, most people will start on a bisphosphonate pill like alendronate, and those type of medications you can take either daily or once a week. There's also an infusion that you can get once a year. And that kind of slows down those cells that break down bones. So if you slow down the bone breakdown, then you should get more reinforcement of the bones. There are also injectables that you can use. There's one medication that you inject once every 6 months. And then there's also a newer treatment that's come out that you get an injection once a month for 12 months. And what that does is the cells that help grow bone and stimulates them to grow more bone at the same time as slowing down the cells that break down bone. So again, that encourages bone regrowth and strengthening.
Are those injections into the bone or just into the muscle?
Just into the muscle. Yeah. You'll come into the office, you'll get an injection in the arm, and you're good to go for another month or another 6 months, depending on which medication you're using.
I read that when sometimes people are diagnosed with osteoporosis, they deal with a depression as a result of that. Have you seen any of that, or is there any merit to that?
There, a lot of times with any sort of indication, when people start to realize that they are aging and maybe not aging successfully, it can affect their mood, and especially if they've seen it, affect the lives of loved ones, mothers or grandparents, parents or grandparents, then they can be like, oh, I saw what this did to them and I don't want that to happen to me. And that can affect their mood as well.
But they should not be afraid to call and to make an appointment.
No.
If they're taking care of mom and dad, or if it's themselves,
right.
If they even suspect that they're getting there.
Right. It's treatable, it's manageable, and you can still live a happy and successful life. And it won't reduce the quality of your life as long as you seek treatment.
But seek treatment early. Don't wait.
Right.
Until the end, and don't be afraid to call. I think so many people, when they hear this or when they hear about it, there's that, for some reason, fear of picking up the phone and thinking they'll be ridiculed at the physician's office, or thinking that they, are just a hypochondriac presenting, and that's not the case at all. Mm-hmm. They're taking care of themselves long term. And so picking up and finding out if you're a candidate for this, and if they don't have it, then the risk factors, I assume, will be explained to them. Right. Here are things you can do to prevent it.
Exactly.
Depending on where you are down the road, here are things we can do to manage it. But it all depends on that patient getting a hold of you early.
Yep. Yep.
So,
and that's why I always advocate for regular checkups with your physician, because again, if they're following that standard procedure of starting screening at 65 or 75, and 65 if you're women, 75 if you're males. If they're doing that regularly and checking that and making sure that you are eating a healthy diet, well-balanced diet, and things like that, then you will reduce your risk of developing osteoporosis. And if you have it, they'll catch it soon enough that they can treat it effectively before something bad like a fracture occurs.
And it is manageable. That's the important point if you catch it early.
Yes.
So, Dr. Carter, thank you for all you do. Thank you for being with us. And I hope people, if they have a sense that they have a brittle bone, give you a call. This is Monsignor Rubino for LECOM Health